a chain breaks always at the weakest link. The general dentist who have not been used to DentiPay, who have not been used to artificial intelligence. I was one of the ones shocked 2-3 weeks ago when he introduced me to Echo, and it blew my mind. I was with Don.
Yeah.
And for 2 hours I said, how is that even possible? Implant dentistry and cosmetic dentistry, but especially implant dentistry, are high-ticket items. It's $3,000 to $7,000. It's not in California, okay? So if you need, let's say, 6 implants and whatever, the $20,000 per job is very common. The age group section of the U.S. population is 65 years and above. And they have, is the biggest transfer of wealth in this country. It's $3 trillion, you can Google it. So we have this 65 and above. We're not talking about millennials, we're not talking about the other young age groups. We're talking about the specific group. They need implants, they need cosmetic, and they have the money, they have disposable income. And when it comes to DentiPay, they are probably the best DentiPay patients or clients because of who they are and the transfer of wealth. So we have to tap into this market, and I'm doing it. So when I opened my dental practice in Santa Ana, of course, my heart was in the right place. I wanted to help the underserved, but I'm a businessman as well. Like every business, even a church is a business, as you know that. So we have to make money. Actually accelerate two recent news. I don't know how much you follow the news. I do. So the governor of California had to save $5 billion. So around a week or 2 weeks ago, he canceled $5 billion for the state of California undocumented immigrants. So now they need DentiPay.
Capitalizing the treatment and having them sign on the dotted line, that is not that comes second to comfort and trust. So when they have trust in the intelligence system, in the DentiPay brand, then the provider becomes not irrelevant, but secondary. Because as Peter's going to indicate, and Peter will talk in a minute, as Peter will indicate, remember the architecture of what's being built is we're learning the symptomology, we're building trust and comfort on the educational side, because nobody's going to, if they can sign on the dotted line for $40,000, $50,000, which is the problem. But the real issue is before that's a problem, it's a real problem if they're not ready to commit and they're not comfortable.
The critical thing that we have to keep in mind while we're building out the interface is that people don't care about, the patients don't care about the numbers, right? They're caring about the pain that they have, the goal that they want to have, the pleasure that they want to go after. And so we have to internally handle all the technical side of, getting them registered, getting them to sign on the dot. We have to think through the conversions on the site itself, but their experience needs to feel like they're building trust all the way through. Their experience needs to feel like they're connecting with the stories of folks like Natalia who've been through it. So on the surface level of the actual website, they need to really just have that high level of trust and believe in what we're doing and believe that it's possible for them. But the technology underneath that needs to be doing the pattern matching. It needs to be doing the conversion rate, when they click, where they click. They need to be seeing the screen. Our system needs to collect the data, and it needs to interact with them in a way that over time it encourages them to convert more.
5-year-old demographic with $3 trillion out there it's exactly what all businesses are looking at, but none more important than dentistry. How does one know that they need implant surgery? Is it bone loss? Most dentists are going to refer this out, correct?
The way he knows is the way Echo and the system has been modeled with the intelligence to know what he knows, not to confirm the diagnosis, but to anticipate the diagnosis. All of this discussion I have painted here, it's diagnosing, looking at what it has, and it's getting as much information ahead of time right now during this process in order to provide the symptomology, the profiling. 10x is the assumption that on the wet dentist model that you would have $30-40 million of capital intensive drag, you would be highly efficient, and you do everything perfectly in 3 to 5 years, hiring many doctors on payroll, salary with equipment. That's 10x maybe. So when we say 10x or 20x, it's not 10x or 20x in a lean fintech model.
No.
It was 10x under a capital intensive drag that would have taken forever, if at all, under those conditions, as opposed to 20 or 25x on a digital fintech pathway, lean and mean architecture that doesn't require anything but the exclusive investment, as we understand technology, the investment in people, and not people that are $250,000 dentist on salary times 25 at 100 times it's $25 million in drag. Okay, we're talking about the investment in technology and architecture and marketing and salespeople and street soldiers that are dropped in like commandos on a street corner. And we don't have to go looking for the practices. Drop them into a zip code and say spend the whole day. There's 15 of them. Start walking. And just like the pharmaceutical reps did with every doctor and every dentist, it's even easier. We're targeting them from social media. We're targeting from direct mail. We're targeting them from text, from email, from direct contact, from seminars, from trade shows, from intellectual forums, from clinical forums. Every place we go, we're targeting that. We're hitting them from every single direction. So the beauty of this is that $10 million, and it's not small money in the world, in fintech world, but $10 million in this model is like 150 million in a capital intensive model. And that money, again, people, technology, infrastructure, and AI, and brand building. And that's where it makes a difference.